Okay, so for my first clinical for adult health, I was with a 64-year-old female who had a small bowel obstruction. She initially went to the emergency room with um, complaints of lower abdominal pain, nausea, and she initially said diarrhea, but that had stopped. Um, so she was actually diagnosed with a perforated bowel obstruction. Um, and so they were doing nasogastric suctioning and then IV lactated ringers and Protonix preventative with preventative for ulcers with the nasogastric suctioning going on. So they were really just awaiting to see if they would do surgery. And this was honestly really cool. I was actually in the room when the doctor came in and discussed if they were going to do surgery or not. They decided not to due to due to her being so high risk. The doctor was just afraid that he would, or she would, keep saying he would, not make it through the surgery. And so also the patient was passing gas, which he saw as a very promising that it could, heal on its own. So they decided that they were going to clamp the NG tube for 4 hours to see how she would react, and then hopefully, if she reacted well, they could start weaning her off of it, and then they can start reintroducing fluids, food, and just seeing how she tolerates, and hopefully she would pass the bowel movement. But after about 3 hours, I don't think she was tolerating it very well. She started having multiple episodes of vomiting, and that was also another concern. And that was a reflective measure that I kind of wanted to pull out on, was advocating for the patient. When the nurse came back in, she was like, has this been happening a lot? And I was like, yeah, I want to say this is her third time since, and it's just keeping on coming. And she even talked to me about it, and I was like, I think it may be beneficial to hook it back up, and she agreed as well. And then was advocating that they start this back up. And she talked to the doctor, and that is what they ended up doing. But it was just really important for me to be it just shows how the doctors aren't there the whole time, so they don't really know how well they're tolerating it. You have to advocate for your patient, reach out, and just try to do whatever is best. Also, for advocating for the patient, I think she really needed information on hospice. And I even told her, I was like, just because you get information on hospice doesn't mean that you have to go through that route. But I think that she definitely needed a referral, and the nurse was talking to her as well, but I don't think she understands really what hospice is, but what she is describing that she wants is what hospice is. So I really think advocating for social work to get in there with hospice, and to just talk to her about what her options are would be super beneficial. Also, the little part of research of my reflection, I was looking into causes of the small bowel obstruction to just kind of pinpoint, maybe what would have caused it. And so according to National Library of Medicine, they have an article on small bowel obstruction. And then under the etiology, it talks about how post-surgical adhesions most commonly form the small bowel obstructions, and carcinated hernias are the second most common. And so actually this kind of lines up perfectly with her case, because she had multiple hernia repairs, and then she also had mesh in her stomach from, I think, one of the hernia repairs. And then I want to say she said she had 13 abdominal surgeries since, like, within the past 30 years. So that's like a lot of scar tissue buildup. That's, with the mesh in there. And also, like, one thing that I noticed was, like, her stomach was, like, rock hard. Like, when I went to go give, like, the, oh shoot, Levaquin, the blood thinner, it was, like, I couldn't even give it, like, really in the abdomen. It was more, like super pubic almost that I gave it, because, like, there was no way that you could even give an injection. It was just so hard. And so I definitely would even, like, looking more into, like, why, like, if it's, like, the scar tissue and everything kind of obstructing, or, what really causes these obstructions based off of the surgeries. So that was the research portion of my reflection that I wanted to focus on. Also, for spirituality, Mary Elizabeth O'Brien, in her book Spirituality and Nursing, on page 261, she has this little quote it says it's by Joanne, a charge nurse at a medical outpatient clinic. She states that dying is part of the life cycle. Some of us will be lucky enough to know when we are going to die and be able to do so in a peaceful way, surrounded by our friends and families. As far as critically ill and dying patients are concerned, you have to plan. They want spiritual comfort. They want information. They want trust and having alleviation of pain. They want to die with the best sense of dignity they can, and that is something I feel nurses can facilitate. It just kind of really resonated with me and, like, hit home, because I didn't know if I would, like the ICU kind of aspect of, like, having, like, a lot of critically ill patients, and you may be coming to terms with death a lot more. But I actually, like, turned around my thinking about that, and I actually kind of find it as, like, a calling to be, like, to make, like, a mark and to help them in this next transition of their life. So that, like, really resonated with me, and I, like, kind of really, like, am definitely, like, interested in, like, more of, like, the ICU atmosphere. But that was, like, my biggest, like, concern was, like, I don't know if I can deal with, like, critical, like, it would wear on me a lot. I felt like it would wear on me a lot if I was, dealing with these critical patients a lot, and maybe even losing many in a week. But yeah, I see it now in a totally different way. Death isn't always a bad thing, especially, like, in my patient's case. Like, I can understand, like, her quality of life is just getting so low. And though, like, you see her age and you're like, you're so young, like, I can respect where she's coming from, and I think that it's a calling to be able to help them in making this decision at the end for the next steps that they want to take. So overall, it was a really beneficial day, and I'm excited for next week and what it holds.